Welcome to ICCG's Close-Up, sponsored by Round World Solutions, where Fortune 1000 CXOs share their enterprise strategies for competing and winning in the global economy. Our wide-ranging topics include big data, governance, supply chain analytics, enterprise mobility, and portfolio management. The goal of our interviews is to understand the CXO's area of focus, the challenges associated with that area, and their plans for confronting those challenges. The benefit to our participants is the creation of a virtual CXO knowledge pool, so CXOs can learn from each other and not have to reinvent the wheel. I'm your host, Ellis Booker. Welcome to ICCG's Close-Up, sponsored by Round World Solutions, the leader in integrated governance with project execution. I'm your host, Ellis Booker. Today our guest is Cassi Birnbaum, 2015 President and Board Chair of the American Health Information Management Association. We're going to be asking Cassi about big data, governance, her association members' experiences and challenges, as well as her priorities and those of the members in the coming year. Welcome to Close-Up, Cassi.
Thank you. Thank you so much for that nice introduction, Ellis. I look forward to being on your program today, and I've got a lot to share with you.
Great. Joining me to ask Cassi some questions, we have Steve Winstead, a Round World Solutions partner. Hello again, Steve.
Hello, Ellis. Pleasure to be here as always.
First off, Cassi, can you tell us about AHIMA and your role there?
Absolutely. So AHIMA represents 101,000 HIM professionals throughout the country as well as the world. So we are global as well. There is an international federation for health information management, and we represent a number of different countries, and we very much partner with them, but we do a lot of the heavy lifting around certification, governance, education, as well as being the professional home to our members. And we also work closely. We have an advocacy office in Washington, so we have a staff there, situated there, monitoring everything that's happening associated with our members of Congress, as well as working very closely with all of the governmental agencies, whether it's CMS, ONC. Additionally, we have what's called a federated model. So we have 52 component state associations. So every state has its own association, but they have to follow AHIMA's requirements, and then if you become an AHIMA member, then we also direct you to the state in terms of resources, advocacy, and again, being the professional home. We also have a House of Delegates. So every state, based on the size of its membership, gets up to 7 members of the House of Delegates. And so we have about 185 individuals that are part of our leadership at that level. The board is comprised of 12 individuals, and then we also have a board advisor. At the present time, our board advisor is David Muntz, and he has an incredible background. He worked under Farzat Mushari, who was one of the ONC chiefs, and so he was the COO for the ONC. He was formerly the CIO at Baylor, and then also was the chief information, not only the CIO, but also did a lot of the planning and development at Texas Health Resources. Mm-hmm. So he sits on our board, and the board is actually elected by our membership. So every year in the or actually the early fall, we have an election. We just, in fact, produced a nominating ballot, and we have a nominating committee that very closely vets those individuals. And
thank you for that description of AHIMA. Obviously, data topics are a huge issue in healthcare, both having to do with recent changes in legislation and also just the forward march of the industry and the profession using data more effectively. Can you tell us some of the trends you've seen with the use of informatics within healthcare from a 10,000-foot level?
absolutely, Ellis. I think the huge challenge for us as we go from volume-based medicine and healthcare to value-based medicine and healthcare, and the fact that data translated to information and then knowledge is critical and pivotal in fueling all of these initiatives. We can't improve population health if we don't get it right for that individual patient. And when you think of how complex providing care to patients is, and then you look at the broader context in which that care is provided within an integrated delivery system, and then as the fact that our patients are moving around, they go from state to state, many patients also are seeking care in other countries with global tourism or medical tourism, global tourism. And so it provides a lot of challenges, certainly to our health information management professionals, but more importantly, just in terms of all aspects of the healthcare ecosystem. So
I was curious, before I kick it over to Steve to ask a couple of questions, can you share with us what the biggest change has been for you personally since joining AHIMA in terms of the way information management has been used in healthcare? What was there one or two big changes? I mean, the internet, for example, or maybe there was something else?
There's been so many huge changes from the way healthcare is being paid and reimbursed to the whole transition from paper to electronic records, and then interoperability and health information exchange, and just the way we do business now. Although I used to say a little prayer every night before I go to bed and just wish that we had a completely paperless system, you know, at times I felt like I was drowning in paper, and now I feel like I'm drowning in data.
Mm.
So, just trying to wrap our arms around it and trying to look at how can we best really control, standardize, exchange, and assure that we've got the right information at the right time when care is being provided. There's so much confusion right now, and I think a lot of the external forces that are driving these changes obviously is healthcare reform, but the fact that many organizations, in an attempt to better situate themselves, are buying up medical group practices, are buying up other hospitals. So there's so much consolidation in the marketplace, and it makes it very tough because you may acquire a medical group practice that is on a legacy platform, or may still have a lot of paper records, and then you have to start from ground zero in terms of getting them ready. And then just because you purchase a hospital doesn't mean that they're going to be on the same EHR platform. And then looking at the master patient index and trying to figure out how to transition to an enterprise-wide platform provides so many different challenges. And then when you look at the larger context of ACOs, accountable care organizations, looking at other types of risk models, it's extremely tough. And I think everyone is a bit overwhelmed, especially as we see organizations ripping and replacing out the EHR that they have because they find that it just doesn't interoperate or play well in the neighborhood as they try to actually work with other organizations.
Yeah, it's quite the challenge, and of course at the end of the day you're dealing with patients and healthcare, and outcomes, and it's so the stakes are quite high, right? Getting this right.
Absolutely.
I'm going to kick it over to Steve to ask our first question about one of the hot topics we at Close Up are asking everybody, and that is big data initiatives. Steve?
Yes, hello, Casey. Thanks so much for joining us today and for the information you've given us so far. Yeah, one of the things, as Ellis had mentioned, around big data, and I wanted to ask you that about big data and analytics, particularly focused around how you see what's happening between the roles between healthcare provider and payer, and how you see those roles sort of working and changing and modifying, especially as regards big data and analytics.
Absolutely. So if we, again, as we look at the broader context and what's happening on the ACO front, which is really the testing grounds for what we're going to see in the future, which is one payment, regardless of provider, and we'll be one happy family instead of everything being parsed out and unbundled. So we'll go back to the way things used to be. So it's very critical in that situation. And again, there's a lot of complexity and sensitivity around the fact that individuals may not want to share information with the payer of that claim. They may. I was at a conference yesterday, and the CMO from Walgreens was talking about the payment model and how kind of what's the interest that they have right now with individuals going and getting treated, whether it's Walmart, Walgreens, or CVS, and the fact that anonymity is a big part of that. So if they want to get tested for some type of STD, they don't want to go to their primary care physician who they may have known for a long time. So they'll actually go to that care delivery model so that they don't have, so no one knows that they've, not only that they've been tested, but what those test results are. And so that's a big conundrum as you think about it. But when you look at all the data being shared among payer, among provider, and then all of a sudden you hear about, well, let's see if we can suppress some information because we know we need this at the point of care, but we don't want to share this with the payer who may have a connection to the employer. So we don't want the employer to know about it. So I think that's where things get rather dicey and difficult from a healthcare context. But in terms of big data and the need to improve the health of the population, and in an ACO model, obviously you're looking at chronic conditions and ways that all the caregivers can come together and work with the payer as well, and certainly risk adjustment is a big component of that, as well as the ultimate outcome. So it's all based on value and how well everyone is able to provide care and make sure that the communication is good among all parties, and that ultimately you're able to really move the needle on improving health. And again, if you don't have good data going into that process, as well as very sophisticated systems, and the systems are just evolving now to really do the really high-end analytics and informatics that really is necessary. And there aren't a lot of people out there that have a lot of the skill set to really move the data and be able to deal with huge systems. And normally,
Casey, we are going to ask you in a minute. I'm very curious to ask you about issues that your members, the HIMA members, may have finding talented staff to run these IT systems that are, as you said, evolving very quickly and meeting all these legislative and privacy mandates. But since you talked about security and privacy a good deal just now, is the industry, at least in the United States, pretty well positioned, do you think, to answer those concerns around patient identity and privacy?
Well, it's interesting because I think that although there have been some very sizable and well-publicized breaches and things that, have gone awry recently, there's still a feeling and an openness to share information. Certainly among the younger population, they're very open about sharing personal information and not thinking all the time about some of the consequences. But I think that there is an element of forgiveness factor, and if you look at some of the recent polls that have been done, in terms of the risk benefit, I think that many consumers of healthcare, understand and recognize that they want to be in the driver's seat, and that's what improving population health is all about: is engaging patients and really holding them accountable for taking care of themselves.
Mm-hmm.
And many payers are also offering incentives, in terms of quitting smoking, so smoking cessation programs, as well as other ways. I've heard of other health plans too that will even give out Fitbits for free and that type of thing. But as we move towards medical homes and really providing care outside of the four walls of a hospital or an ambulatory clinic, it really is incumbent upon patients to, share their information. It has to be easy, it has to be simple, it has to be rather seamless. So,
right, and as you were talking about the analytics that, say, a hospital or a doctor is using, isn't it the case that patients increasingly want access to the dashboard? They want to see their own, in the case of a Fitbit, they want to see their own dashboard on that. So that's a new layer of complexity that didn't exist a few years ago, I guess, right?
Absolutely. It's really an exciting time for us. And again, there's that balance that we're all seeing in terms of patients really wanting to step up to the plate and try to improve their health and well-being. And if we can, there's a lot of trust that goes into making this model effective. In fact, there was a panel discussion that I heard yesterday and about really how to move the needle, because not only do patients need to trust the system, but also physicians need to trust it as well. So it's not going to do us any good if patients are contributing in terms of, data at the point of care. So patient-generated data that is able to come into a healthcare system, to whatever their medical home is, if the physician isn't going to feel as though they can trust, if it's point of care testing that they're doing, looking at glucose monitoring, and if they have to come into the hospital and then repeat those tests. So we really need to really change the way that we look at things. But certainly I think with patient portals and physician portals, I think we've certainly made some improvements. There's a lot that needs to be done. And when I was at HIMSS a few weeks ago, interoperability is still the watchword. And, the finger has been pointed to the large EHR vendors for making it difficult to share information across, the entire communities. And
EHR for electronic health record, just
correct.
for our audience who may not be familiar with that term.
One thing, Casey, also is, all these challenges that you're talking about, obviously, are going to create interesting needs around data governance. Could you sort of chat with us a bit about what you see as the big data governance requirements in healthcare at the moment?
Certainly. AHIMA has been spending a lot of time over many years looking at data integrity, data governance, IT governance. And during our strategic planning sessions, probably a good 3 years ago, we decided that we really needed to look at a broader initiative than just data governance and really focusing on the clinical side of healthcare. So we really broadened the initiative, and now we're calling it information governance. And data governance is a piece of it, as well as IT governance. But we're really looking at all information that needs to be generated, preserved, collected, and then ultimately looking at the final disposition of that data stream. So whether it's clinical, financial, or operational, and wanting to make sure that there are rules, that there are protections around that type of data, and that it is controlled throughout the healthcare ecosystem. And we're looking at a whole model or framework that looks at the information governance principles for healthcare. So we've looked at information governance practices in business and industry, and then how they need to be adapted or modified to be successful in healthcare. And then we've developed an IG maturity model to look at where organizations are now and where they need to be, and what are the gaps that need to be mitigated. So we've come up with 100 attributes and a scale from 1 to 5, with 1 being an organization that's really just beginning to look at this and wrap their arms around it, to an organization that's at a transformational stage. And we actually are, we've selected 20 pilot sites, so all different types and sizes and footprints of hospitals, health systems. We have some governmental agencies that have chosen to participate, along with payer groups.
Casey, how many of those transformational organizations has AHIMA found at this point? I don't know how many hospital organizations and medical practices there are, but of the 10 or 11 or 12,000 of them in the United States, something like that, what percentage are at that stage 5 right now?
Right. So we actually did a very comprehensive survey and looked at a number of organizations, and also sent the survey out to the C-suite, all different positions within the organization. And really, we didn't find anyone that was at that stage 5 in healthcare. So probably the highest rated organization was in maybe the 3 area, so somewhere in the middle. But even those organizations that have really tried to organize themselves and focus around that. I know the organization that I worked at for many years, we did have a lot of good practices in place, but again, we were focused more on the clinical side of the equation, although we did quite a bit with HR data, with financial data, and any information that was really touching the ERP system as well. So I felt like we probably had a better handle than many organizations do, but we were far from being at that transformational stage. And then the third component of our framework are tools and resources. So we have a lot of really good, we have white papers, we've actually published 2 books on information governance, along with a number of books over the years on data integrity and all aspects from the master patient index issues and patient matching to patient identity and some of the challenges that come along with that. So we have a lot of tools and resources. A byproduct of the pilot project that we're launching is to test the maturity model, test the information governance principles for healthcare, and finally make sure that we've got the tools, the resources in order for the entire healthcare system to be successful in this. And we have collaborated, we're not doing this on our own, so we have collaborated with other associations, as well as even the Joint Commission on Accreditation for Hospitals as part of this. Governmental agencies have joined the effort. We've met with ONC, with CMS, the White House. So we have really gotten out there, and a lot of organizations, or all the organizations that we're working with, have really rallied around this effort and really feel that we're well positioned to take this to the next level.
Right. It sounds like you are, as an organization, AHIMA is making progress in addressing some of these thorny issues around governance and data governance, but that causes me to loop back to something I said I was going to ask you about before, and that is finding staff who can understand these informatics topics and also talk to the clinical staff and possibly patient advocates and possibly even patients on the other end, and payers, insurance companies, and so forth. You said that that was an issue. How can AHIMA help healthcare organizations find the right staff, or are you working on any training programs, certification programs for that?
Absolutely. So we have spent a lot of time, energy, and money on really surveying the workforce and looking at where the gaps are, and really looking at the vision of the future and where we need our workforce. And you know, we surveyed from the top on down in terms of the perception in the industry of where our professionals are now and where they need to be. And also certainly looped in HR VPs as well as, you know, everyone else that, you know, we really needed to mobilize as far as the whole educational field, other associations as well. And AHIMA does have a very robust certification track. So it's called CHIM, the Certification Commission for Health Informatics and Information Management. And then we also have, it used to be an affiliate of AHIMA, and now it is its own entity, but it's called CAHIM, the Commission on Accreditation for Health Information and Informatics Management. And all of the academic programs throughout the country are many. There are some that you know haven't applied for that status, but are approved by CAHIM. And AHIMA is a member of CAHIM, and recently AHIMA joined CAHIM as well. And so that program actually oversees to make sure that all of our health information management and health informatics programs at the associate, bachelor's, baccalaureate, and master's level, and at this point we don't have any PhD programs, but we're certainly, or there actually, I take that back, I think there might be a few, but we oversee to make sure that that all of the competencies, all of the requirements are meeting the highest level. And so those were just redone last year. There's still, you know, it's a moving target because the industry is moving very, very quickly. And we've been able to gain a lot of information from the workforce studies that have been done to really help the profession as well as our members, and then certainly with the academic arm and the certification arm to figure out where we need to go. There is a certification track for informatics and for analytics, and that's a certification called the CHDA, the Certified Data Health Analytics individual. So we do have, one of our goals is to increase the number of individuals that hold the CHDA. And then on the academic side, as I said, the programs that are growing the fastest are the ones on health informatics. So at the bachelor's and master's level. So we're seeing a lot of interest in that. But to your point, you know, do we have enough trained individuals that really, you know, understand it, that with the competencies that we've developed, can they attain those? And so we're doing a lot in terms of educating, first of all, informing members about information governance and all of the different roles and responsibilities, and including the whole patient experience, because our members can also help show the way and navigate patients in order to assure that their interaction with healthcare is the best that it can be. Mm-hmm. And that the outcomes we're achieving, you know, are going to move the needle in that direction, in a positive direction.
Casey, in the time remaining, Steve and I have two final questions for you. I'll take the first one, and I'll let Steve take the second. What are AHIMA's top, say, 2 goals in the coming year, would you say?
The top 2 goals would be information governance, as well as all of our strategic initiatives around health informatics. And health informatics is the umbrella for all of the standards, interoperability, everything we're doing with ICD-10 transition, which is so necessary in order to have the granular data necessary to fuel these initiatives. Everything we're doing around even the terminology, certainly clinical documentation improvement is a big component within that area. Being able to do all of the, the analytics, the making sure that EHRs are structured, and that the data integrity pieces are well spelled out. So those would be the 2. We have other pillars. And now, one thing I want to make clear, that public good, which is a very important strategic pillar, and consumer engagement, that is woven into information governance as well as health informatics. And then also the leadership component is critical to these initiatives, wanting to make sure that our members feel comfortable in leading these initiatives and really, providing what's needed in order to, again, make sure that we have the right information at the right time for the right patient.
And Casey, one final question from me would be, what you see as the top priorities for your membership within, again, this sort of abbreviated time frame of the next year or so.
The top priority for our members are to make sure that they feel comfortable and confident in leading these very critical initiatives, and that they understand, how the dots are connected and why it's so important that they step up to the plate, lead, not follow. And there are a lot of challenges, but there's a lot of opportunities as well. And if we can't get it right one patient at a time, then we're not going to get the outcomes that we need, and we're not going to be able to improve patient care.
Well, that'll have to do it as the final answer. I want to thank Cassi Birnbaum of AHIMA for joining us on ICCG's Close-Up. Fascinating information about a very important sector, healthcare. If you'd like to watch other Close-Up interviews, you can go to iccgusa.org or roundworldsolutions.com. There you can participate in discussion or get involved and be a panelist yourself for one of our close-ups. Thanks for watching.
I'm Scott Cunningham, Senior Director, Solutions and Delivery for Round World Solutions, the experts in integrated governance with project execution. Our unique 360-degree view enables us to give CXOs a comprehensive view of where they are today, where they would like to be, and delivers a powerful change management structure to ensure they accomplish their goals. ICCG Close-Up is an interview panel where CXOs share their views on big data, governance, and their most pressing issues. At the conclusion of the interviews, we will be compiling the results into an industry and issue-specific report to share with all of the interviewees, emphasizing common interests and future plans associated with those interests across industries. The benefits to our participating CXOs are the creation of a virtual CXO interactive knowledge base, highly scaled shared resources, and the ability to learn from each other without having to reinvent the wheel. Thank you for watching ICCG's Close-Up, sponsored by Round World Solutions. For more information about our CXO interview panels or to join the conversation, please visit us at www.roundworldsolutions.com. Thank you.